The following education video will cover the Education Outcome Record Flowsheet. We will begin by looking at the purpose of this flowsheet. It is to document education provided to the patient, to document the patient's comprehension of the education provided, and to document core measures and required education from the plan of care. We will now discuss the access to the flowsheet. You will begin by choosing the correct patient. You will then click on the Flowsheets tab. From here, on the left-hand side under Flowsheet Selection, you will locate the Education Outcome Record Flowsheet and single-click. We will now go over documentation. The documentation requirements for the education flowsheet is in reference to the policy stated. Each patient, family member, or significant other will have their learning needs assessed. Documentation will occur after the education information instructions, either formal or informal, occur between a licensed staff and a patient's significant other or caregiver. Document if the patient is unable to meet the goals. We will now return to the flowsheet. We will begin by adding a single time column to document. This should be in real time, however, occurring after the education is provided to the patient, significant other, or learner. We will now go over each parameter available. The first one speaks to the teaching or learning assessment. While you will be assessing the patient, there is an opportunity to assess another learner. In the next area for individualized goals and outcomes, we typically don't document here, but leave it open in the event the patient requests specific education we do not address. The next area speaks to admission education, which we will cover in depth a little bit later. These are the points that we want to educate on admission, including the safety and fall prevention, which is right below in the patient education. The next parameter is the patient education. This is the day-to-day education you may provide to your patient. Next to the medications option, in this field, we have a pick list that's been provided of a general idea of medications. You may choose a category, and then in the free text field, type the specific education. Who you taught, how you taught. If you provided any written material, please specify the source, and if the patient understood or not. Our review code will depend on whether or not we need to retouch on this subject again. Isolation precautions. We have our MRSA positive education, again, only if isolation or MRSA apply to the patient. Any diagnostic tests or procedures, again, you may choose from a department and then the specific test can go into the blank field here. We have a post-procedure pick list. You can use this for any post-procedure or angiogram. So you may need to choose multiple selections here. Patient care and equipment and supplies. If the patient does have an indwelling catheter or a central line, you must document to this education provided. If the patient is in restraints, and a joint class. We also have another education parameter that allows us to provide education to a patient caregiver or provider. So the first pick list is going to allow us to choose what we're teaching, how we're individually assessing them, and whether or not they were efficient in their assessment. The teaching method, and for medication administration, that we are teaching all of the medication administration process. We need to determine if the provider is able to care for the patient or not. The last area here has to do with discharge instructions. This is the comprehension of the discharge instructions provided, and this will be documented too once the patient has been discharged or once you've provided those instructions. The next type of education you may see on this flow sheet appears in green. This is core measure education. You will note that there is a little icon next to the teaching criteria, and this means it's coming straight from an order. Once that order is placed, it will populate to your flow sheet. All of the education has a title at the top, and then who you provided instruction to, how you taught them, and how they understood or what their comprehension was. This education is required documentation prior to the patient going home. If it isn't completed, you won't be able to complete your discharge instructions. The next education area is also green, and this is coming from the care plan or the CPG added. Here you will also see a header and the education to be taught. Let's take a look at the reference data for our CPG or care plan education. For any green parameter, you may right-click and choose the option of Show Reference Data. This is often helpful to understand what the education or teaching components are. Here you will see that on letter B, the second option down, that the education that needs to be taught regarding this care plan. We will now take a look at the education documentation on the adult patient profile. There is some functionality that will cross from your profile to the flow sheet. You will access the adult patient profile. Once you access this, on the left-hand side in the Sections tab, under Significant Indicators, we will start with locating our teaching or learning assessment. You will note the significant icons. Make the selections that are appropriate based on your assessment of the patient and their learning needs. From here, you will locate the admission education, which is just a little bit further down. And here, as we've seen prior, each one is set up with a pick list, instruction provided to, your teaching method, and your evaluation method. Here you will see the pain and pain management that's available. Your fall handout education. We then have the room and unit orientation. Each of these should be chosen. And you may add any additional information that you taught to the patient in the comment field if needed. The next area we have is the rapid response. For family, again, you should be choosing both of these fields. And lastly, we have our hygiene instruction, where you can speak to the patient about their hand washing, oral care, gelling in, gelling out, and personal hygiene. This can be not only taught to the patient, but their family and friends as well. The last area is for isolation. This may or may not apply to your patient. If it does, you will choose appropriately, and if it doesn't, in the far left column under Education Review, you may use the Not Applicable. Choose Save when completed. Once you submit as incomplete or as complete, and you take a look back at the adult education outcome record, you will note there is a time column that has been time-stamped and added based on when you access the adult patient profile. And all of the information that you added once you saved it has crossed over. Notice that the teaching or learning assessment is missing a few fields. You may simply click back into your time column that you created and add to it, as not all of these data points are present on the adult patient profile. Scrolling down, you will see that the admission education has been documented too, and this is also based on the documentation you just provided on your profile. Save your information, and that is complete.